Pediatric cancer is the leading cause of disease-related death in children. Despite that status, it's still a rare disease setting. And so oftentimes when families are first thrust into this space, historically what you'd find is parents carrying folders like this, like high, right, from place to place, trying to connect and find information. They will be at multiple hospitals, trying to get multiple inputs from multiple clinicians, from multiple experts. At the same time, they're interacting with clinicians who themselves, right, are trying to think about, well, where is all your data across all these hospitals? What clinical trials are available for you or not available for you? Many of those efforts are held together by a human infrastructure, incredibly dedicated families, foundations, clinicians, whole teams who are humaning their way through a data-driven decision-making process in ways that has been challenged to scale. Where does that data live? How does it get connected? How does it get continuously integrated so that you inform and learn, not just for that patient, but for the next patient? And what are the tools that need to be developed? So Radiant actually is the next step in a series of problems we've been trying to solve in the context of pediatric cancers and other rare diseases. We had been building and managing large-scale infrastructure for data sets. We saw all the power that could be harnessed when you start building that kind of infrastructure on behalf of multiple communities all at once.
Radiant project has been a great proof of concept. This is the first time we demonstrated a near real-time exchange of data across two large healthcare institutions that spans multimodal data that includes EHR, clinical data, as well as genomics and imaging data. To the larger pediatric care expansion effort, our goal is to then expand this beyond 2 sites into 200 sites so that the patients can really leverage the knowledge that exists collectively across these multi-site institutions to better inform their care journey. For example, if you're a caregiver bringing your child to a rural clinic in Alabama, your clinician can immediately have access to data that's been collected across the nation, for example, in a large hospital in Boston, which has never been done before.
ARPA-H is helping to bridge across that real-world clinical healthcare framework, that research infrastructure, to lay that foundation, to really transform that information to knowledge, to impact in care decisions for patients.
We're going to really bring data to life from all of the patients that have gone through the journey in the past to inform better care for the patients that are going through the journey today. At the end of the day, PCX is really going to accelerate how we do pediatric care.